afternoon, and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Margie Prop. Thank you, Margie, and thanks to everyone for joining us. Let's start with an update on our local situation. As expected, we're experiencing an increase in new cases. A combination of people letting down their guard, holiday gatherings, and the arrival of the Omicron variant are causing this jump. As you can see on the chart, the sharp increase in cases beginning December 27th, rising from an average of 128 cases per day to 218 cases by the end of the week on the 31st. The positivity rate also jumped higher as well. At the end of last week, it was 16.7%. Keep in mind, it was 11.9% the week prior. We're learning from experiences with the new variant overseas and in other parts of the U.S., and we anticipate a continued increase in cases over the next period of time. Current data shows the majority of Omicron cases are mild, but it's spreading fast and causing a large number of cases over a short time. Many communities across the country, including Omaha, have set new records for cases in a week, even exceeding last winter's surge. Even though most cases are mild, this may result in significant increases in hospitalization, especially for people who are unvaccinated. This could impact business and government services that we rely on as these organizations try to cope with many employees becoming ill at the same time. Some disruptions in service should be expected, and all businesses should be planning for this by reviewing their pandemic plans for continuity of operations. On a large scale, we've seen impacts continue with hospitals and healthcare in general. We've seen the travel industry hit hard, and there are also concerns with safely keeping schools and universities open and functioning. The City of Lincoln and Lancaster County are both prepared to address any staffing shortages and have plans in place to respond to ensure services continue to be provided. In looking at our local hospitalizations, we did see a slight increase this past week. The 7-day rolling average was up from 112 on December 24th to an average of 121 at the end of last week on January 1st. Even though many people will experience milder illness with Omicron, the sheer number of new cases anticipated will most likely cause an increase in people seeking care, and our hospitals are already very stressed. As we've shared previously, the majority of people hospitalized are those who have chosen to remain unvaccinated. Omicron can affect those more severely than those who are vaccinated. Please get vaccinated now. Today, our local hospitals report 113 COVID-19 patients, with 17 on ventilators. 72 of these patients are Lancaster County residents. And sadly, there are 3 deaths to report today: 2 women in their 70s and a man in his 50s. Also, over the past few weeks, many of our key indicators have continued to move higher. The case rate and positivity rate have quickly increased again. Contact tracing is becoming more difficult due to the large number of cases and difficulty reaching people over the holidays. Hospitalizations and deaths remain high. All of these factors have pushed us into red on the risk dial. Red indicates the risk of spread and impact in the community is severe. And on this color-coded map showing the key indicators are our local case rate, positivity rate, hospital capacity, and contact tracing that are all now in the red category. COVID deaths remain in the orange category. Testing turnaround time and overall vaccination rate remain in green. The position of the dial is shown by the blue square outlined in red, which can be seen now in the red area. We have updated public guidance, which is now posted on covid19.lincoln.ne.gov. The choices we make on a daily basis affect our level of risk and the risk we may pose to others. We have the information and the tools we need to make choices that protect ourselves, our loved ones, and our community. Please get vaccinated or boosted now. Wear a mask indoors and around other people from outside your household. Avoid crowds and big events such as concerts and athletic events. And if you choose to take that risk, wear a mask. Get tested before gathering, or if you have COVID-19 symptoms or have been exposed to someone who has the virus. Stay home and away from others if you're sick. Watch your distance and wash your hands. As we've said before, prevention remains the most effective option for reducing the impact of this disease on our lives and livelihoods. Vaccines continue to help protect against severe illness and save lives. They are also a critical tool for reducing the impact of the virus and its variants, like Omicron, on our healthcare system and the community. And here's a quick rundown of the latest vaccination stats. Over 64% of all Lancaster County residents are fully vaccinated. 55% of our residents aged 16 and over who are eligible have now received a booster or third dose. And almost 24% of children ages 5 through 11 are now fully vaccinated, and just over 32% have received their first dose. So parents, if your child hasn't received vaccine yet, we urge you to act now to better protect them. The health department and our partners continue efforts to accelerate vaccinations and make getting a first or second dose or a booster easy, convenient, and close to home. We had mentioned that after the first of the year, we'd ramp up our community clinics. We're working with Lincoln Public Schools to host walk-in clinics this weekend, and the first one will be at Kohler Middle School. That clinic will run Saturday, January 8th from 9 a.m. to 3 p.m. And our next one is Sunday, January 9th from 9 a.m. till noon. Both clinics will offer first and second doses for age 5 and older, Pfizer booster doses for age 16 and older, and Moderna booster doses for 18 and older. From start to finish, the process usually takes less than an hour. And people can schedule an appointment at covid19.lincoln.ne.gov or by calling us at 402-441-4200. We're offering clinics every day this week, including several at the health department. Additional clinic times and locations are available on the COVID-19 website. And remember, local pharmacies and pediatric practices are also offering vaccine in our community. I want to provide a quick update on some other new developments on the vaccine front. Yesterday, the Food and Drug Administration expanded Pfizer booster doses to include 12 to 15-year-olds. The next step is for the Centers for Disease Control and Prevention to decide whether to recommend boosters for younger teens. A decision is expected later this week. If the CDC gives approval, we'll be ready to start administering boosters to this age group as soon as possible, and we will share more information at that time. And earlier today, the CDC announced that a third primary dose of vaccine is recommended for children 5 to 11-year-olds with weakened immune systems, and this is 28 days after they have received their second dose. And also at this time, Pfizer really is the only vaccine that's authorized and recommending booster this for those children age 5 to 11. The CDC also updated recommendations for when people can receive a booster dose, shortening the time frame from 6 months to 5 months for people who receive Pfizer vaccine. This means people can now receive a booster dose 5 months after completing their Pfizer primary series. The booster recommendations for Moderna are 6 months after the second dose, and J&J are 2 months after the initial dose, and that has not changed. And now turning to the COVID-19 treatments, there is also a newly approved monoclonal antibody treatment that will be available in our community soon. More information about this option and its availability will be out later this week. As individuals and as a community, we continue to face the challenges brought on by this pandemic. Prevention is our best option. We have the information and the tools needed to make choices that protect ourselves, our loved ones, and our community. So please get vaccinated, get your booster, mask up, get tested, stay home if you're sick, watch your distance, and wash your hands. And with that, we'll take any questions.
So Pat, KLN is asking whether there'll be more testing sites planned for Lincoln.
I just talked to NAMI, and they're adding another lane for testing and doing something better with their traffic control efforts out there. And our police department is working with them on that, and we'll be continuing to work with them. We are also looking at another testing site in Lincoln, and that's being evaluated right now. That it? Okay.
Matt has asked, no DHM, but are there additional measures planned?
You know, we have said that when the DHM wasn't extended, that we were urging people to wear their masks. We urged schools to include masking. We think it's one of our most valuable tools outside of vaccination that we have. And I'm really trying to get people to understand that you are taking a risk when you go out into large groups. And I mentioned a few of those activities. So if you're going to take that risk, if you decided, then please wear a mask, because the variant is it's over 53% of the cases now. And across the state, the positivity rate is even higher than it is here in Lincoln. So at this point, we're not issuing a DHM, but as I've said, we're keeping all our tools available to us, and we'll respond as necessary.
He's asking, is that 53% of cases here in Lincoln?
It's 53% of the cases in the state.
And then Bria has asked from 1011, with home tests, are you concerned about the accuracy in testing numbers?
Yes, people don't report home tests to us necessarily, and that's something that we have to deal with and account for, but I think our numbers from the test results we do have are extremely concerning. We're also looking at the various types of home tests and which ones are authorized and effective and approved for use. Okay.
Matt has asked, do you have any information on how many Omicron cases have been confirmed locally, or what the percentage is?
We have, I'm not going to use a percentage, but from the sequencing we have, I think we have close to 10 now at this time that are Omicron related, but we know that we have community spread, and I can keep you updated as we gather more information. It just depends. All these tests to be diagnosed have to be sequenced, and for example, testing done at NAMI is not sequenced. So, but we are seeing cases across many other health departments in the state as well. Is that it? Okay. Thanks again for joining us today.